Conversation today, we're joined by Dr. Benjamin Purow, a neuro-oncologist at UVA Health. He's sitting down with Casey.
All right, thank you so much, Steve. Thank you so much for being here with us today.
My pleasure.
Yeah, we are happy to have you. And today we are talking about glioblastomas. For people who might not know, what are they?
Sure. So glioblastoma is the most common form of brain cancer or brain tumor. We sometimes shy away from the term cancer, but most common kind of brain tumor. They occur in about 13,000 people a year in the United States. It's actually the most common kind of brain tumor, unlike certain other cancer types where the most benign forms may be more common. Glioblastoma is a little bit different. It's the most aggressive form of this group of brain tumors, which we call gliomas. It tends to be very invasive around the brain. Can cause all kinds of terrible symptoms. It's not actually a curable cancer as of yet, but certainly we're fighting hard to turn that around.
Yeah, and you mentioned some of the symptoms it can cause. What are some of the symptoms that people should look out for?
Sure. So it can occur anywhere in the brain, so there are really a plethora of symptoms that can show up, and seizures are fairly common. As sort of the most obvious initial symptom and the thing that might bring people to medical attention. And seizures can take almost any form. People are used to hearing about sort of the old term grand mal seizures, where the whole people become unconscious and their whole body may jerk. But seizures can look like almost anything. So it's transient episodes of something motor or even something sensory or something like not being able to speak. A period of not being able to speak, memory problems people can also present with, bad headaches are another fairly common symptom that people can show up with. Sometimes weakness that can be, instead of a seizure, just show up on a more permanent basis in part of the body, sort of a stable symptom like that. So those are some of the symptoms.
You got to keep an eye out for it. And you mentioned there's no cure, but what are some of the treatment options that are available right now?
Sure. So typically patients with GBM are initially treated with as much surgery as is safe. Our excellent neurosurgeon colleagues will take out as much of the tumor area as is possible, but these are so invasive that we can't ever get a cure that way because there are always some of these glioblastoma cells that have slipped out of the initial tumor. So after that initial surgery, we give people about a month off of treatment, let them heal up, and then we do a 6-week course of focused radiation where the tumor is, combined with a pretty gentle form of oral chemotherapy called temozolomide or Temodar. And that's followed with more of that same chemotherapy drug, Temodar, but we do it in pulses. We also look at brain MRIs pretty frequently to see how things look every couple of months. Typically, we'll do a brain MRI. Outside of that, there are some other treatments that are FDA approved for recurrent glioblastoma after it comes back, and that can include some other chemotherapy agents. There's an IV drug called Avastin or bevacizumab, which tries to starve the tumor of its blood supply. There's actually also an FDA-approved treatment that's electrical, where people are actually putting on a device that applies an electrical current to the head, that's another option. Those are all the FDA-approved options. Outside of that, there are potentially clinical trials and experimental treatments.
And speaking of that, you all are doing some research, ongoing research, to improve care for glioblastoma and similar conditions. Before we go, just tell us a little bit about kind of where that's at, what you all are doing.
Sure. There's some exciting things going on at University of Virginia as well as other places around the country and the world. There's lots of exciting research going on. Some of it is geared towards immunotherapy at UVA, for example. We have some immunotherapy approaches, novel immunotherapy approaches that we're trying. Using new agents. There are also techniques like focused ultrasound, and UVA, University of Virginia, has been one of the pioneering institutions for focused ultrasound treatments, and that's on the rise as well. In my own research, we are really trying a host of approaches. A lot of it's trying to repurpose existing drugs but use them a little smarter if we can, partly to do things like stimulate an immune response against the glioblastoma, but also to do things like target existing drugs to a subset of glioblastoma. We have actually quite a lot of tools in the toolbox, and if we just use them better, I think we can get more mileage against this terrible cancer.
Yeah, well, it's amazing work you all are doing. Thank you so much for taking the time to tell us a little bit about it.
My pleasure. Thank you for having me.
Yes, we'll have you back soon. And Steve, back over to you.